coffin joint is obviously encased inside the hoof itself. It is a joint that exists between the third phalanx or the coffin bone and the short pastern bone. Another integral part is that the flexor tendon, which runs along and attaches on the base of the coffin bone itself, and houses basically or has the navicular bone attached across it as it runs underneath there, is part of this structure, or at least incorporated into part of the structure along with the navicular bursa. So all these things are interrelated. What we find with the coffin joint is if it's not a problem, it usually doesn't ever get noticed much. But if it becomes a problem, it's usually a big problem. Coffin joint arthritis is a pretty complex problem that comes from performance, but can occur in almost any type of performance horse, whether it be a racehorse, a dressage horse, a Western pleasure horse, a roping horse, or you name it. And the problem is that when you get deterioration there, or you get inflammation there, or a lack or loss of the cartilage in the coffin joint between the P3 or third phalanx and the second phalanx, or problems in the navicular bursa area, these things all tend to interrelate, and they can create a pretty profound lameness, because somewhere on the order of between 23 to 27% of the movement from the end of the cannon bone down to the ground is involved in the coffin joint itself. So you cannot lose any appreciable movement or flexion or movement in the coffin joint itself without affecting the overall gait of the horse.
Are there things that could lead a horse to having coffin joint issues, like a bad angle of a foot or things like that would maybe predispose a horse to coffin joint issues?
Yes, definitely. I mean, obviously they have a predisposition based on if you've got way too low an angle, too long a toe. Mm-hmm. These things will cause the extensor process of P1 or P3 to come up into and bang on hyperextension into the pastern. So therefore you can create more and more irritation to the extensor process and or the structure associated with it. And in addition, this also with low heel, long toe situation can also create problems with the navicular bursa, which basically is interrelated with the coffin joint itself. So maintaining proper angle with 3-year blacksmith is paramount. Maintaining length of toe, as far as like backing it up properly, can help maintain that coffin joint and the soundness associated with it. Making sure that you don't chop their heels off and lowering that angle will essentially maintain the coffin joint conformation and or the decrease the predisposition to coffin joint arthritis or inflammation or problems with this. So a combination of balance, shoeing, symmetry, and attention to proper measurements of the toe and the wall and the angle are all paramount to maintaining coffin joint soundness and or the status of the coffin joint itself.
So how would you diagnose a horse that has a coffin joint lameness?
Well, it's actually quite interesting. I learned it, when I was working on standardbreds primarily, but now I utilize it, in all sorts of different horses, show horses, race horses, standardbreds. What we find is that a lot of horses with coffin joint problems tend to show that they have a very shuffly gait. They don't tend to extend as well you want. And people, I think, get the impression that the horse doesn't want to extend. And I think really it's more of a component that they don't want to pull that leg back as far, because on more hyperextension with the limb back, the coffin joint arthritis creates more discomfort. So they tend to keep their limbs out in front of them and tend to shuffle a little bit short, so they don't have as much differentiation to stride. On physical examination, what I see on a high percentage of these cases is they have a fusion to their fetlocks. But when you isolate fetlock fusion or a fetlock flexion, you don't get much reaction on the flexion on the exam itself. But when you incorporate coffin joint flexion with it, you see a pretty profound reaction. A lot of times what I will do is I'll watch a horse trot, then I'll come back and put him in a flex situation and trog him off, and we'll see that we exaggerate a lameness problem or a deficit in that limb. And then we'll do it on the other side and we see the same sort of thing. So it tends to be bilateral, with one tend to be more prominent than the other, which is not unusual in any lameness case.
I didn't mean to interrupt you, but coffin joint flexion and fetlock flexion are really completely two different things.
Well, they can be, yeah, they can be. But unfortunately, when you add in the coffin joint itself, you'd like to grab the pastern and flex the coffin, isolate it from the fetlock itself. So it takes a little bit more experience, knowledge, and a lot more detail when you do this. But you need to, isolate both in order to get the best or the most out of your examination to determine where the source is coming from.
Now, can you X-ray a coffin joint and to diagnose that way as
Definitely. Well, I mean, I don't use the X-ray for the diagnosis, but I'll certainly use it for confirmation of deficit or a problem in that area for sure.
Well, and here's the ultimate question: how do you treat it?
Well, it depends. It depends on the severity. Sometimes something as simple as shoeing can remedy the problem. Sometimes you have to be more aggressive. Sometimes you have to, go with anti-inflammatory. Sometimes you have to go with topical therapy. Sometimes you have to go with intra-articular injection. Sometimes you need to go with a combination of all the above: shoeing, topical, medication, and injection in order to maximize the horse. Sometimes we see very, very profound changes by a combination of these things. Sometimes we can just do one thing and we can basically make the horse go 100%. So it depends on the severity, the diagnostics, the treatment, and response to the therapy. And all these things will give you a better feel for how your horse is going to do and if you can maintain him or not.
How important is the synovial fluid around a coffin joint?
Oh, yeah, it's very, very important. Very important to maintain the quality of this fluid. This is the lifeline. This fluid is the lifeline of the synovium to that cartilage to maintain those structures, to help get the most amount of lubrication, lack of or decrease the inflammation, and to get the maximum amount of better quality fluid in that joint. And when you get that, you basically get a good clinical response, or the best clinical response when you get that. Earlier, the better, more preventative versus trying to do it after the fact.
Yeah. Is there a correlation or relation between coffin joint soreness and navicular?
Yes, most definitely. They're very, very intimately related. As we can see here anatomically, the coffin bone is right here. Here's the pastern that we're talking about. And here, this small bone right here, number 4, is the navicular bone itself, okay? This is the coffin joint. As you can see, the coffin joint also exists down in here where it is intimately attached to the navicular, and the navicular bursa is a small sac that basically occurs right in behind here, okay, underneath the deep flexor tendon. So when you have problems with one, you tend to have interrelated problems with the other as well. And we will utilize injection of the coffin joint itself to help improve navicular bursa inflammation or decrease it, and or problems in the coffin joint itself.
Now, in this type of injury, is there a way to feel for heat in a horse's hoof? Is that directly related to these issues?
Yes, it is. Actually, the pulse and the heat in the foot itself. What I do is when I'm doing a physical examination, I can feel pressure right here on the outside of the coffin joint itself when there's effusion or excessive amount of fluid there. In addition, you can feel sometimes when there's too much fluid in the navicular bursa that will back up into the digital sheath. You can feel fluid right back in here in the ball, between the bulbs of the heel, or back in the digital sheath. Okay, and when we pick it up and we flex it, we get a pretty profound reaction or withdrawal response, or they try to pull the limb away when we flex the coffin joint.
Okay.
Navicular disease is an area where you have deterioration primarily in this bone in the coffin, or inside the foot itself. Typically, a horse that has navicular disease or heel syndrome or heel soreness, which is chronic, usually is a foot that is very, very small for the mount or the size of the horse. They tend to be contracted or closed in. They tend to be, basically too small-footed, essentially, for the size of mass of the horse is. What we see is this area on radiographs, soreness we see with hoof testers, soreness across the base of the frog and or the base of the heel where the navicular bone resides up in here. And we see a very, very typical short and sometimes obviously a lame gait, at the trot, both directions, with the being worse on the inside of a circle. And so what we do is, to try to remedy this, we will address therapy to protect this area from concussion improve the area of circulation and try to make breakover easier, where we'll go ahead and roll the toe and allow this horse to break over easier so we take less pressure on the heel itself. That's what our therapy is directed toward. We can also inject a coffin bone or coffin joint to get circulation or improve fluid to the navicular bursa and the structure supporting the navicular. And in addition, you can systemic medications, anti-inflammatories, azoxaprine, and then sometimes anticoagulant therapy, things of this nature can help circulation in this area as well.
Yeah. Now, on my travels out and about for promoting Luberson, I talk to a lot of people that have issues with navicular. So it seems to be an issue with older horses, primarily.
More commonly older. We see early problems with heel syndrome, but the true navicular disease, I haven't ever seen personally in a horse any younger than 5. That's been my impression over the years.
And it is treatable. It's something that a horse can live with.
Early on, typically same situation as usual. Preventative medicine being better than restorative. The quicker that you can address this area, maintain their breakover, maintain the health of the coffin joint, the navicular bursa, protect the area of the frog, and/or allow for expansion. All the normal things. The better you're going to be off early, and you're going to maintain their soundness much longer and have a lot more productive career.
And how about diagnosing navicular? What's some of the symptoms a horse would show?
Well, obviously lameness for one in one limb versus the other, more the inside limb versus the outside on a circle. Obviously they're going to have conformation, small foot, big heavy-bodied horse, typically more quarter horses than others. Yeah. And another thing we see pretty typical is they can have increased pulse, and we usually can block them out with just a posterior digital nerve block, and we see improvement, drastic improvement right away.